Hello, everybody. This is Dr. Connors. We are going to be talking about a new approach to helping block cancer and stimulate apoptosis. It's through a specific cell surface protein called the ENOX2 protein. There's actually three ENOX proteins. It's the ENOX2 that we're going to be mainly concerned with this talk, and you'll see why. The ENOX2 protein resides on the cell surface. The cell surface, it is shed into the bloodstream, so it can actually be used as a marker. Matter of fact, many of you may have heard about the Oncoblot test as a marker that is no longer available due to cost. But there's a new test coming out, and there'll be a new presentation on that in a little bit too. So watch for that as a video as well. Well, it's been determined that this ENOX2 protein has the ability to help us manage cancer. It is a very good diagnostic aid. As I said, there was a test that could read ENOX2 proteins, and it became too costly for the lab to continue the test. But it is in this talk, we're going to talk about it as a therapeutic target. Drug target, but actually a nutritional target, and you'll see what I'm talking about. It has two distinct functions. It plays a role in cell enlargement and cell growth. It also plays a role in a different way to stimulate glycolysis. And these two ways are very important with a cancer patient, because if you're stimulating glycolysis in a cancer patient, you are feeding that cancer. And as you know, that's a very big concern on how we're looking at cancer, if we can cut off its supplies. ENOX2, when it is expressed, it blocks apoptosis and stimulates glycolysis. So it's a very important marker in the sense that if we have ENOX2 expressed, you know that you have cancer. And if we could somehow block the ENOX2 expression, then we could, through the ENOX2 pathway, very effectively help a cancer patient reduce the feeding of the cancer through glycolysis. So ENOX1 is a different pathway that's expressed in all non-cancer cells. It's again a cell surface ENOX protein. And understand these are genes, but this is not a genetic defect, so it's important to know that as well. So we're not looking for a genetic defect, we're looking for the expression of that gene. ENOX2 cells with this being expressed always have uncontrolled growth. So it is never expressed in someone who doesn't have cancer. So that's the benefit of it as a marker, but that's also the benefit in targeting it too. So there is zero harm in targeting it if you use a substance to target it that isn't harmful to the rest of your cells. So what ENOX2 does, as it's expressed, it enables basically uncontrolled growth and replication of cells. And that's what cancer is. So that's what we're trying to prevent. So it is, again, it's an X chromosome marker, though it is a gene. Everybody's going to have an ENOX2 gene, an ENOX1 gene, because that's the protein that it makes is on with everyone, though it won't be expressed if you don't have cancer. So it's very important to know that we're looking for the expression of the gene, not just the defect itself. So we're not looking at your genetic test or your 23andMe and do you have an ENOX2 defect. That's not what we're looking at. We're looking at the expression. And those kind of tests become more costly. That's why that test had gone under. I know a number of my patients had done the Oncoblot test. I used to do it all the time. It's just not available anymore. So the benefit of targeting this is that even in very, very early cancers long before you can see them with any imaging. So long before you would ever know that you have cancer, in stage 0 cancers, the ENOX2 gene is going to be expressed. So it is one of the first things that it's expressed. It's in tumorigenesis, meaning that that's when the tumor is just beginning. That's when the expression of the ENOX gene occurs. So there's benefit to, even if, let's say, I don't have cancer, but there's cancer in my family, using the things that we're going to talk about in the next few slides can be extremely beneficial to help prevent that. Meaning I've said many times that all of us have cancer growing in us, and it depends on if our immune system is taking care of it and winning the battle or losing the battle, that I will eventually get cancer. Well, here's one of the ways that you could help yourself win the battle, or your loved ones win the battle if you have cancer, by using targeted nutrition to help block this ENOX pathway. You could, if you're going to get cancer sometime in your life, you could push it farther out. So it's a very novel approach. Here's the intervention site on the gene. It's kind of complicated as we look at the genes. And this is where we want to intervene with a drug approach or a nutritional approach. And as they started studying this, they started to discover that this is actually how some of the chemotherapy drugs work, which was quite interesting. Like cisplatin, a very common chemotherapy drug, actually one of the mechanisms of action is as it blocks the ENOX2. Now, of course, some of these drugs are extremely harmful to our body, so we'd have to use them in a fairly high dose for them to be very effective in blocking the ENOX2 pathway, so they would be contraindicated. But what they found was two really novel approaches. EGCG from green tea extract and capsaicin, which is from cayenne, does a fantastic job in blocking this. And there really is no dose limiting toxicity to either of these nutritional products. I guess you can take too much of it, but you're not going to have any side effects from this. So taking capsaicin or cayenne pepper and EGCG, you don't want to just, I'm going to drink a whole bunch of green tea. You'd have to drink about 100 glasses of green tea to get as much EGCG as you need. But taking EGCG and cayenne pepper can be a fantastic novel approach to add to literally every cancer picture, because every cancer, doesn't make any difference what type of cancer it is going to express the ENOX2 protein. So by addressing this, and this is, I'm trying to get this video to all our cancer patients because this is new information for me, by adding cayenne pepper and EGCG to your approach. Now, I have a number of my patients on EGCG now because EGCG is really the only way to deal with interleukin 6 expression, which is inflammatory marker that's found with metastasis to the bone. So most of my patients that have metastasis to the bone, I already have you on EGCG, but adding cayenne pepper. So in the other patients that I don't have on either one of these, it may be a good, fairly inexpensive way to add just another approach to block the ENOX protein. We have both of these available in our store. The standard process product of cayenne is a great product of cayenne, a good whole food product, and our own EGCG. And you could take 3 to 6 of these a day. I'd start off with 3 a day of them, especially with the cayenne, as it can be a little sensitive to your tummy. Take these with food, I would suggest. And you could bump up to 6 a day depending on what stage you're at in your cancer. And for a patient who doesn't have cancer, for your loved ones, it could be good to take 1 to 2 of these a day to help prevent that, because Even again, if you're in the very early stage, undetected, zero symptoms, it could be 5 to 10 years away before you're diagnosed with cancer. If you can start blocking this ENOX2 pathway, you can prevent cancer. This is what we need to get into more, is the prevention of cancer, and because that's exactly where it targets. So the cayenne and the EGCG, a great intervention to block ENOX2, which is going to be expressed in every form of cancer. So something to put in your arsenal. All right, thank you.